we change lives, and that's very exciting to me.
We grow everything here. We grow everything, sweet corn, you name it, we grow it here. And which, those farm workers, a lot of times can't get away to go to bigger towns when they are sick. And so this clinic is very, very important to this community.
I actually grew up here in this community, and so being able to see something like this offered to the small community of Olathe is very exciting.
I believe that it's making a healthier community.
The clinic used to be owned and operated by Montrose Memorial Hospital, and has been around for about 9 years now. So they've done a wonderful job in supporting the healthcare needs of the community. The hospital, as well as the Center for Mental Health and the school district, went together and decided they really needed to apply for an FQHC status, which would allow this clinic to do more for the community.
I actually helped write that initial application for the Federally Qualified Health Center in December of 2010. And so the federal government ran out of money, and we had to put on hold, and we reauthorized back in April of 2012 and were awarded in June of 2012.
I really think we're a gem in the community.
Nowadays it's a little bit bigger, a lot bigger, not a little, a lot. They're still friendly, they still take good care of us. The staff is amazing. Even for a patient, they go out of their way.
You're dealing with the front desk ladies, and all of them are always super nice. They all care. Everybody seems to care. I've been at clinics before where they just feel like you feel like you're a number.
Our neighbors and our friends, and people we trust. That's the most important. We're treated like a person, not a number.
We have a great team that works together, and we really want to offer patients quality care.
We all have a family member or know someone who needs medical care and aren't able to get in to see a physician because they may not have a form of payment, or not all physicians are accepting Medicaid. So I see this as a really great need for the community.
As the Affordable Care Act has made a lot of changes in the healthcare industry in this country, many more people have Medicaid now, and they're struggling to find a provider to go to.
Especially with those adults that couldn't qualify before for Medicaid, now could qualify depending on their income. So we have qualified a lot of those adults into Medicaid. So not a lot of clinics around town are accepting Medicaid. So here at the clinic we do take Medicaid, but we do have a waiting list.
We do have a large uninsured population, and the migrant farm workers who they have nowhere to go.
And then it costs the hospitals more because they're using the ER as a doctor's office instead of as what it truly needs to be used for. So.
We have a waiting list, and there are people that are not able to get in the clinic that need our services, and they're not able to find care elsewhere. So the space really limits us being able to serve our community.
Right now we have 4 exam rooms. It's very hard to provide good quality patient care when we're in a small cramped area, and can't take the time to really do warm handoffs because we're needing that exam room for the next patient.
It's very difficult because, we're split up between 2 buildings. So if it's kind of hard for us to kind of communicate. The walls are about this thin and there's no room. Like where we're going to move to in the fall, we're going to see so many more patients, and I think we can do a lot more. But here it's just we don't get to see very many patients. We're all just split up, and it's just the building is not working for us.
And I see cracks in the floor, and there are leaks in the ceiling, and it's not a professional area to serve our patients.
This was a good start. This was a very good start. The building was a good start, and it was a good area to get started in. They need to grow. there's more patients, there's more complicated patients.
As we look forward to the future and being able to serve the patients in the community, there's a lot of patients that don't have a medical home, that probably haven't had medical care in a few years, so it's exciting to be able to offer that and be there for them and changing people's lives.
We want to be able to get in all patients that we can get in because, as I said, the need for health services and mental health services in this area is great. So this new facility will have 9 exam rooms and a procedure room, so we'll be able to see probably twice as many patients as we can see today in this small facility.
That's what I'm really looking forward to, is having the 9 rooms and all these, new providers that they're taking on, because our patients that we're going to be seeing in a day is just going to expand.
I think will bring a sense of pride to the area. I think that the stores and the community will really increase and we'll have more people visiting the area.
So I think it's a win-win opportunity for both the community and the clinic.
The new building will give us more access to get more people in.
And I am so excited with all of us being together and patient rooms and what's going to happen. I am so excited.
Past, it's a clinic that's been here for a long time and has served its community well. Present, we're growing, we're moving, and in the future we really hope to be a facility that can fully serve our community and all of the healthcare and mental health care needs of this area.